My name's Tim Partridge. I'm a primary care sports medicine physician. I'm at Central Vermont Medical Center in the UVM Health Network. I also am the medical director and head team physician for Norwich University. A lot of my experience with brain injury and concussion comes from athletes because of my training. Norwich has a lot of collision sports, a lot of the highest risk sports. They're also, with their military background, a lot of the cadets suffer concussions as well, even outside the scope of kind of a sports event. So we're doing a lot of concussion management, and also at Central Vermont Medical Center, we have a really nice concussion kind of work group where there's a nice interaction between the physicians, the primary care sports physicians, the rehabilitation team, and there's a nice collaboration there. So we're very actively involved in trying to promote our management strategies and help educate other providers in the area. So that's really my experience. I'm the chair for the concussion work group at Central Vermont Medical Center. Concussions are a big part of what I do. I see at least a couple every week, and really I think my approach is that it's very individualized. Concussions are not, we don't have very specific symptoms that are, if you have these symptoms, you have a concussion. You have to take every single case, every single person, and consider what are their pre-existing medical conditions, what's the context in which they were injured, what are they going to school, are they trying to work, how does this affect their daily life, how does this affect relationships, and so there's really an individualized approach for concussion management. What we've been migrating towards more recently is trying to cluster some of the symptoms, and then if we can see a certain patient has a lot of symptoms that may be consistent with, say, exacerbation of underlying mental illness like depression or anxiety, then we can get more directed active treatment for that cluster. So I mentioned mental health. That's a very common one that can be exacerbated. You can also get kind of more physical symptoms like neck strain and associated headaches, and even neurologic involvement like occipital neuralgia. That's very common. So then if we identify that that's the case, then there can be maybe some specific modalities that physical therapists can work with. There's vestibulo-ocular derangement, which is being increasingly recognized as being associated with prolonged recovery, particularly in pediatric patients. So if we're able to identify maybe a specific cluster of symptoms, that helps us, instead of just recommending, patience and reassurance, this helps us understand that we might actually be able to do something more active to help kind of spur along their recovery. There is a large component of it that is, there is patience and is allowing for some of the healing to occur. Yeah, so there are return to learn, return to play guidelines. This is if you're not malleable, you're going to fall out of practice pretty quickly because these recommendations are rapidly changing. My medical society, the American Medical Society for Sports Medicine, literally in the last week just produced another consensus statement on concussion. So there's a lot of new stuff in there. They're not necessarily like landmark. This whole way we treated concussions has now completely changed. It's more just an evolution. For example, we used to say, all right, you have a concussion, silence, lock yourself in a room, no stimulation, try to use your brain as little as possible, and we've actually realized that can actually be associated with prolonged recovery. So what we're trying to do now is, again, make it very individualized, where we're trying to allow that individual to do as much as they can up to a point where they might become symptomatic. So if they're feeling up to going to school, if this is a student, let's maybe try some school and see how they do, and if they become symptomatic, then we can scale back. Similarly, we used to say only, physical activity once these certain criteria are met, but we've realized that sometimes getting some physical activity can be helpful. Now, we have to be very clear because we don't want people just, doing any physical activity or doing any mental or stimulating activity without guidance, you certainly want to operate within the confines of our typical protocol, which for sports is going to be a stepwise thing where you're having increasing intensity of exercise. But that being said, there are circumstances where if someone's having prolonged symptoms, we might actually let them do a little bit of exercise, get their heart rate up. And more recent evidence is suggesting that can be beneficial for their healing. So it's not, again, it's not as rigid as we have to stay within the confines of this specific protocol. That is definitely used as a guideline in how we like to advance people. But once again, the key is making it very individualized for wherever that person's at and what symptoms they have and what activities they are involved in. Yeah. I mean, all of treating concussions in general is very challenging just because of the, we call it heterogeneous nature, meaning there's just so many different flavors of it. And so just trying to figure out what combination of treatments is going to work for this individual is something that, that's probably the most challenging thing right there. But it's also satisfying because you get to know the person, and you have to get to know the person in order to figure out what is going to impact them and what's going to help spur them towards recovery. Because otherwise they can definitely, a lot of people do kind of stagnate and don't get better and kind of struggle with the same symptoms. And sometimes it's just identifying, hey, maybe there's a different way we can approach this. And it might not be the same way that we approach someone else with very similar symptoms. So that's the challenging part, that there's not a, defined algorithm that we just work through to, all right, you're at this stage, we're going to treat you with these treatment modalities or this medication. And then once you progress to this stage, then we change. Everything's just so individualized. That's the most challenging aspect of it. Yeah, you got to be very flexible too, and you got to be humble, because the patient you saw maybe for a concussion a year ago, if they had another concussion and come back a year later, you might be giving them a different story about, well, I know we treated you like this last year, but actually things have evolved, and we're going to take this different approach because it seems like that might be the best approach. So you got to be humble, you got to be flexible, and you got to be willing to change how you treat, and you got to stay up to date on everything that's coming out. I guess you're not asking this question, but I will say, a really important thing to keep in mind is to not take maybe what the media is putting out there and running away with it, because a lot of what is put out there is more attention grabbing, like headline grabbing news, and they might take a lot of liberties with how they might interpret a particular study. Concussions are associated with increased risk of this condition or suicide, or and there's a lot of extrapolations that occur when you come up with those headlines. So to be very careful not to, you got to be a skeptic. You got to really scrutinize when you hear a headline. You go, okay, and you got to go back and look at the study and understand, was this a high quality study? Was this sufficiently powered? Is what they're saying the conclusion is actually what the data is telling you? And a lot of times there's a lot of liberties taken with how that's reported. So I don't think the media has done us a lot of favors with maybe how some of these papers are being reported, or how some of the the conclusions are being reported, because I think it's more designed to grab a headline than it is to actually accurately reflect kind of the state of management for concussion. So there's the key thing is there's just a lot we don't know, and we got to acknowledge that first and foremost. And that's probably the biggest truth of concussions, is there's so much that we don't know, that we can't make a lot of definitive judgments on how it might affect you down the line. Everyone's going to evolve from their situation a little bit differently.